Hello, I'm Sarah McGee, Chief Policy and Government Affairs Officer, and I have the honor of working for a dynamic organization serving new mothers, their babies, and nurses who support families in their journey to great health and prosperity. Our models and staff support over 60,000 families per year in 41 states with over 2,000 nurses on the front lines for building stronger communities. We could not achieve our mission of positively transforming the lives of vulnerable babies, mothers, and families without the support of legislative and executive champions. The enthusiastic bipartisan support of officials at the local, state, and federal levels enable us to continue changing lives across the country.
Giving children a healthy start is where they're going to succeed or have a better chance of success in the long run as they begin pre-K or kindergarten.
Prioritizing maternal infant health is so critical to serving our underserved and our most vulnerable populations. I have a real heart and passion for this. My mother taught obstetrics nursing for 36 years. And so I learned firsthand about what happens when women do not have access to care and education. So I am a huge champion for the Nurse Family Partnership.
If you're able to get upstream of all the problems that we face today by addressing maternal child health early on, then the entire system is so much the better for it, and it has a huge impact on people's lives.
As we look at something as precious as childbearing, we want to make sure that our families have the right resources to be able to survive and move forward in today's world. I would say that most of my constituents are very aware of the need and to try and address these things to the best that we can, and with a little federal help and obviously with organizations like this, we're all better off.
About 10 years ago, when we really started trying to address our problem with low birth weight babies and prenatal care, I got interested in programs that have shown success. There are a lot of programs out there, but the Nurse Family Program has shown incredible kind of success, and I'm interested in programs that are evidence-based and actually show good results.
What I wish that my colleagues understood and knew about NFP is that it's evidence-based. We have a lot of people come to us in the legislature that want us to fund programs, but we have no data to say that they work or not. NFP is an evidence-based program. It really, really does make a difference.
I would urge my colleagues to fully support the Nurse Family Partnership programs and to support increasing funding so that more families throughout the state can have access to this program.
I was able to visit what NFP calls a graduation ceremony. The family connection that had occurred between the medical professional and the family was extraordinary. And then to hear the value and the worth of a program in such an extraordinary way, to see the tears, to see the connection between the medical caregiver and the actual caregiver in the household. It was looking at a family structure that was global and inclusive.
I am definitely a champion and a proponent of the Nurse Family Partnership. I think it is imperative that we keep it going, keep it funded, and expand and grow upon it. This program is an economic benefit, if you will, to our state, in the fact that for every dollar invested in the Nurse Family Partnership, it saves almost $8 in future costs for these high-risk families. So the return on our investment is astronomical, if you will, as we continue to focus on this type of program.
The more access to healthcare, prenatal services that these mothers have, the more that we can really improve outcomes, which is what we're trying to do. We're saving lives here.
Obviously, I am a big champion in investing in evidence-based programs to save lives and improve maternal and infant health outcomes, programs like the Nurse Family Partnership. And we have to continue to fund these programs.
We are successfully serving families and achieving our organizational mission due to the powerful public-private partnerships with public champions, passionate advocates, and community change makers. Thank you for leaning into the important work supporting new mothers, loving families, and hardworking nurses and clinicians.